Again this morning, Dr. Kothary, Chief Medical Officer for Dignity Health of Central California Division, and he joins us this morning to give us the latest updates on COVID-19 here in Kern County and across the country. Dr. Kothary, thanks so much for being with us.
Well, thanks for having me once again.
So we had that big Senate hearing yesterday on reopening the country. We heard from Dr. Fauci about his warnings about reopening too quickly. So as our nation begins to reopen, are we going to see an increase of cases of coronavirus?
I think there's always that potential, and I think certain parts of the country are at a higher risk of having a resurgence versus other parts. I think the West Coast, especially Kern County, we are going to experience a lot of warm weather, and which is going to help inhibit the virus from resurging again. So I think the West Coast is going to be a lot safer than the East Coast, versus other parts of the country.
And we heard Dr. Fauci talking about what's to come in the fall. Yesterday when he testified, talking about children going back to school in the fall and what that could look like. Is there a point where we could see a resurgence of cases come fall or later on down the road where we would need to go back to all of these strict restrictions and social distancing and closing things down again?
So, yes, I definitely think there's going to be a resurgence for sure. But in terms of closing things down, staying at home orders, I don't think we'll see that at all. I think our economy cannot withstand that a second time around. And what we'll also see is a lot more medications that are going to be available to us to help limit the course of this virus and also the severity of the symptoms as well.
We heard yesterday Dr. Fauci talking about a vaccine and how, it would be wishful thinking to think that we'd be getting that by fall or something like that. And you yourself has said you don't really think that this is going to be about at least until 2021. It could be a year or two. But the treatments are what we're kind of hanging our hat on as far as going forward, right? Can you talk about some of those?
Yeah, absolutely. So we've got a lot of good data coming out from a couple of different drugs, the most popular being a medication called remdesivir, which is made by a company called Gilead. And it's gotten FDA approval already about a week and a half ago to start using it in sick people. And the reason for that is we don't have the supply. But I think come fall, the company's going to have enough supply to where we can use it for helping shorten the course of the virus and the severity of the symptoms. So we'll get it like a medication that we all know called Tamiflu. So you go into your doctor's office, you say, we'll also have the capacity to test people. We'll test you if you're COVID positive. We'll give you this prescription. You go home and rest, and you get better in a few days.
That's certainly encouraging news there. So I was looking around yesterday, and I read that the FDA has actually approved 2 at-home collection kits. Everyone wants to know how to get tested. We've got a lot of new testing sites here in Kern County. However, there is a way through this test by LabCorp to get a test sent to your home. You use it there, you collect your own sample, and then you send it out where a lab will test it. What do you think about those kinds of at-home collection tests? Do you think that people should order those?
So I currently do not think so. And the reason is the way we collect these samples, it's actually it's not very comfortable to do. So we have trained nursing staff that does this for us. And the problem is if you collect this incorrectly and you send it off and it comes back negative, now you have a false sense of security when you may actually have the virus. So we are telling people just to get it at these testing facilities where people have been trained to collect these samples properly.
Okay, and again, there are 6 new testing sites expected to be opened across Kern County, many where you don't even need to have symptoms to be tested. So there are a lot more options than there were just about 2 weeks ago. Dr. Kothary is going to stick around and join us for a Facebook Live at about 7:10 this morning, and he will take your questions, viewer questions. So get those questions ready and join us on Facebook Live at 7:10. Dr. Kothary, we'll see you there. Thank you so much, sir.
Absolutely. Thank you.